Well, thanks for choosing Morning Live and thanks for staying with us. Now, South Africa has recorded nearly 60% more natural deaths than expected in recent weeks, which suggests the possibility of a much higher death toll from the coronavirus than officially reported. Now, this is according to the South African Medical Research Council's latest report on weekly deaths. And there have been more than 17,000 excess deaths in the weeks between the 6th of May and July the 14th. And to tell us more about this, we're joined now by Professor Debbie Bradshaw, who's Chief Specialist Scientist at SAMRC. Thanks so much for joining us this morning, Professor.
Good morning, and good morning to your listeners.
Now, firstly, Professor Bradshaw, what do you mean by natural deaths first and foremost, and what is excess natural death?
Yes, the terms are a little bit specific, but when a death is registered, they identify whether it's a so-called natural cause, which would be a medical condition, a disease, or even the natural frailty and old age. They also distinguish the unnatural causes of death, which are those that come from a motor car accident or from homicide or other external causes. So we at the Medical Research Council have been tracking the trends in the numbers of deaths from natural causes and from unnatural. At the beginning, should I carry on or?
No, please conclude. I'm sorry I interjected. I thought you had concluded your point there, Professor Bradshaw.
I had answered your question, yes, but I was going to tell you a little more. What I wanted to say was that at the Medical Research Council, we've been getting data from the Department of Home Affairs based on the deaths that get registered with them. And we've been tracking for quite a few years, we've been tracking the numbers of deaths from natural and unnatural deaths. And at the beginning of the year, we thought we'd better start watching it very closely. And so we've started monitoring it on a weekly basis.
So in the report, Professor Bradshaw, the report talks about excess deaths that have been attributed to people not getting tested for coronavirus, and for those who are in need of it, there's a lack of access to healthcare facilities. Please talk to us a little bit more about this and give us a little more detail behind that particular assertion.
Okay, so firstly, let me explain the excess deaths. What we did was, from the historical data that we have, we worked out what number of deaths we would expect each week. And there's a distinct pattern in the number of deaths. During winter, they go up a bit, and through the year, they go down, although there's a bit of a peak at the end of the year. So the expected number that we were anticipating from the historical data, we would use that as the base for what anything above that would be considered excess. So we've calculated the difference because it's 50-60% higher than what would be expected from historical data. We've calculated what we consider would be excess. And what we're finding is that the number of excess natural deaths are somewhat higher than expected for this time of the year. But that's not unexpected because the country is going through an epidemic that's unfolding, firstly in the Western Cape and spread to other provinces. But the number of excess deaths is a lot larger than the number of confirmed COVID deaths. We come in.
It's an interesting point that you make there, Professor Bradshaw, because the question then becomes, how do you go about collecting your data in this instance on a weekly death report? Is this something that is standardized? And in terms of your actual numbers, what are we actually looking at when you're saying that, there could be about a 60% discrepancy at this stage? What would we normally be looking at this stage of the year? And what are we actually seeing in the numbers that you have?
So our data is quite limited. It would be ideal to get information on what the actual causes of death have been. The doctors, when they certify the cause of death, they provide information as to what the disease was that was the underlying reason for the death. But we've got a challenge because it takes time for those forms to be verified and then processed for statistical purposes. So at the moment, we don't have access to that information. So all that we're working on are the total numbers, and we can see that the total numbers have gone up. They've gone up very much in the adult over, let's say, 50 years of age, but particularly in the older South Africans, over 60, over 70. And that's very consistent with COVID as a disease and the risk factors that make people more vulnerable, hypertension and diabetes. The HIV is playing a role as well as TB. We would love to have information on what the causes are, but that's going to take some time to get. So we're really using historical information to guide us as to what or how to interpret what's going on, as well as looking at other countries. And in other countries, we've seen that the confirmed COVID deaths are often understated because they come from the health services, and there are people in the community who die before getting to the health service. So we're really using information from the experience in other countries to interpret what we see.
So what does all of this say about the integrity of all the information, all the statistics that we currently have around COVID-19? Because by your own admission, Professor Bradshaw, your own numbers, the numbers that you are looking at are limited. And as you say, if we look at the reporting, even in other countries like the UK, like the US, around the world, there have been some discrepancies there as well in terms of what is expected to be the actual numbers and what is being reported. So in terms of the integrity of the statistics around COVID-19, who should we look to?
I think we should be looking at all the different data sources that we can get hold of. And so I think the overview that the MRC provides by tracking all cause of death and those that are natural gives us a piece of information. We have to see how they tally with other things. And at the moment, it is pointing to particularly some provinces where the confirmed COVID death numbers seem to be on the low side. And it may be because the hospitals are overwhelmed and the collection of statistics has fallen behind a bit. But I think we have to be careful and take multiple sources of data together to get the overall picture.
Professor Bradshaw, there are also reports at the moment that most deaths that occur now are recorded as COVID-19 deaths, even if no test was conducted. So do you know any of this? To the best of your knowledge, is this kind of argument correct at this point, that we should be concerned about everything now being basically related to COVID, even if it may not be?
We've, at the Medical Research Council, we've also heard anecdotes like that, but we've also heard other stories, which I'm afraid are all anecdotal at the moment. We've heard stories where doctors feel they've been told they must not report COVID because it's creating a fuss. So I think we have to be cautious with all the data sources and try our best to put together the picture. The one angle that another angle that we take to look at it is to look at the case fatality rate. So if we divide the number of deaths from COVID by the number of COVID positives, South Africa has an extremely low case fatality rate. And if we were to take the excess deaths and say that the majority of them are from COVID, it would push our case fatality rate up to about just under 5%, which is very comparable with many of the country experiencing the epidemic. So, as I'm saying, what we have to do is try and triangulate all the information to get the best picture.
A bit exasperating, I must admit, but we've also seen a backlog in people being tested and receiving their results. In addition to that, we know there's a shortage of test kits for COVID-19 in the country. Now, what sort of risk does this pose in trying to understand the true numbers around coronavirus at any given time?
Your words, it's a bit exasperating. It's very challenging, and the hospital or the Department of Health needs to track the number of admissions it's getting. It needs to track the deaths that occur in the facilities, and look at the higher level picture as well as the very detailed results that are coming from the testing or from the confirmed COVID deaths. I think it's quite clear from all of the information that we're in the midst of the storm of the epidemic. The Gauteng area is clearly there's a big outbreak happening. And I think there's signs that KwaZulu-Natal is also about to happen as well. So I think what's really important is to get across the message to people is that it's in our hands. We have to really make effort to keep our social distance and to wear our masks and to wash our hands and to brace ourselves.
Now, Professor, as you said, we are now in the midst of a storm, so I would think that you would expect this trend to increase now that we are in the midst of that peak season for this pandemic in South Africa. But what else can be done in terms of just the numbers and trying to get that right? Because, again, as you say, when people are not testing, how do we say with any sort of conviction that these are COVID-19 related deaths? But on the other hand, there was a story I saw yesterday about what's happening in KwaZulu-Natal, where they are saying that they are seeing an increase in the number of people who are dying at home, because people are perhaps not being tested and not making it to the healthcare facilities to seek the necessary help. How do we go about increasing the access for ordinary people so that they can actually get the help that they need timeously?
Yeah, I can't, I'm not a health service person, and I know I'm based in Cape Town. I do know that there have been a lot of efforts to try and get care to the community. So people who are on chronic medication, rather than having them come to the clinic and expose themselves, they've tried to get the medicines to the person at home. But when somebody's sick, they need to get to the health facility. And I'm sure every single health facility in South Africa is trying its hardest to do infection control and make sure that somebody who comes to the facility isn't exposing themselves.
Well, Professor Bradshaw, thank you so much for your time this morning. We'll leave it there. Professor Debbie Bradshaw is the Chief Specialist Scientist at the South African Medical Research Council, talking to us about their weekly death report. And they are saying that there have been more than 17,000 excess deaths in the weeks between the 6th of May and the 14th of July in South Africa, and that this could be attributed to the underreporting of COVID-19 cases. We're going to take a quick break. We'll share some of your responses to our question of the day after this.